You have questions? We have answers. Welcome to the Therapist Question Box with your host, Miss Lindsay Schiss.
Welcome back to another episode of the Therapist Question Box, where we're not afraid of anything. So ask away. We're here to tackle your tough questions. So today we're going to be talking about a diagnosis and when a diagnosis, a mental health diagnosis, is helpful. Today I have Brannon Patrick on the show who's going to help us really dive deep into the benefits of getting a mental health diagnosis. You know, getting a mental health diagnosis can provide clarity and direction for those that are seeking support. I really like to think of it like a physical health diagnosis. It's just a label for particular symptoms that a person's going through. So there's a lot of fear and maybe stigma around diagnosing. So it can be daunting. However, it can also be a step towards healing. So Brannon, let me ask you, do you diagnose or do you shy away from it? What are your thoughts around mental health diagnosing?
Yes and yes.
Okay. Explain.
So this is actually a really good topic because there's pros and cons, and it's not so clear cut, and it's also complex in so many ways. It could lead to discussions about our healthcare system, about treatment, about all kinds of things. So, but yes, I do think at times a diagnosis is very helpful and very good, where it can give answers to people who have just been struggling. It can inform treatment and help us know what treatment plan we're going to do and why. There's a why behind it. So it can be a relief to the client. It's interesting because it can go either way. It can be a relief, but it can also be a big burden and really sad to get a diagnosis. Mental health is interesting, Lindsay, if you think about it, because if let's say I had prostate cancer and I went to the doctor, I would be grateful. I wouldn't be grateful for the diagnosis, but I'd be grateful for the diagnosis. Right? I'd be like, okay, like we know what we're dealing with. I'm glad that we have medical professionals that can figure out what this is. Mental health is a little different, right? Because a lot of times it's a little different, but it's actually not. So a lot of times people look at it and they're like, oh, like that's just in your head. Get over it. You do this to yourself. You create your own suffering. You know, if you would just change the way that you think or act or behave, then you wouldn't have to deal with these things in your life. And to some degree, that's true. Sometimes that's true. And sometimes it's not. Sometimes it's a mental health disorder that is very different than just changing the way that you're thinking, and it's just in your head.
So that's an interesting perspective, because I think what you just said is maybe part of the reason it's challenging for people. How do I know what's really in my head and what's a mental health diagnosis? Like is there a fine line? Is there gray? Like, what does that look like?
I think there's a big problem with like over-diagnosis and just jumping to conclusions too soon. Like, you think about people who diagnose. I think the people who diagnose the most are the spouse of the person who's annoying.
True. Yeah.
It's like,
I want to have a reason for this. I want to understand why this is happening. Yeah.
Yeah. But so like, yeah, they're just depressed or they're narcissistic or they're borderline or whatever they are. That's a problem. In a lot of, and we can talk about that later, but that's a problem in a lot of different ways. And the spouse is not the professional to actually give that diagnosis. Yeah. And a lot of times what will happen is then they end up in therapy, and a therapist gets involved in some, and I'm using a couple as an example here, but a therapist, I think, can diagnose too quickly and too easily a lot of times. where they jump to conclusions and they kind of have a confirmation bias mindset where they see something and they just go, and that's what it is. I think therapists need to pump the brakes a little bit and make sure that they got their ducks in a row to actually give a proper diagnosis. Because if you give a diagnosis too easily, it can be a big problem.
For sure. Well, and when you think about that, if you're in a couple situation and there's frustration and your partner says, well, you must be narcissistic, Brannon. Well, that is now become a weapon, right?
Yeah.
That doesn't feel like something helpful. That feels like, oh my gosh, now you're going to be using that against me, right? So when you say that, like, it's never appropriate to diagnose each other. I often think that in the seat too. When I'm in the seat with another client, I think this is for you. This is not your partner. Just look at yourself. What's going on for you, not your parents, not your partner. But it's really easy to diagnose other people. And I think we have so many diagnoses. It feels rampant. It feels like everyone's diagnosing everyone. You get on TikTok, you get on Instagram, there's diagnoses thrown out like candy.
A good diagnosis is much more rational, logical, and scientific than it is emotional. And so if I have an emotional bias as to why I need a diagnosis to come, whether it's to my spouse or even myself or whatever, that can actually get in the way. Sorry, Lindsay, I have planes flying over my head.
You're okay. We're recording. Brannon's in Hawaii right now, so we're grateful to have it. It's all good. We can't hear it. It's fine. As you were saying too, that we need to make sure that we don't overdiagnose too quickly. I thought the same principle would apply. You may see a client one time or two times and maybe they're going through something. So they present as really anxious, but getting to know them over time, you would know, okay, maybe that's just situational versus this is really who they are and how they're functioning in their day-to-day lives.
Yeah, and the criteria of diagnosis, we'll look at things like rate and duration and how consistent the symptoms are and things like that, as opposed to like, oh, you're anxious, you have an anxiety disorder. Your spouse is annoyed by you, you're a narcissist. Like that's an emotional diagnosis versus an actual process to do an evaluation to understand what's actually going on with a person that has nothing to do with, the emotions of it. Now, Lindsay, I do want to say the example I'm giving about couples. A lot of times someone will want a diagnosis because there's all kinds of reasons. Well, if they're this, then that justifies me doing this or that or divorce or whatever it is, right? But sometimes that partner wants a diagnosis just for some answers. Sometimes it's a huge relief to the partner of like, oh, that's what we're actually dealing with here. I remember years ago, I actually gave a borderline diagnosis, and the partner was like, oh my gosh, like this gives me so many answers as to what I've been living in. And it was the diagnosis was so important to him. And then to her, have you ever diagnosed a borderline with
I have
told a borderline that they have borderline?
Yeah. How do you feel it goes over usually?
Well, that's a tricky one. For that, it was like, thank you so much. You are the best therapist ever to actually be honest with me. Like, I love you. You're the best. And then like the next week it was like, screw you. Like, I'm not that. Like, how dare you?
That's right. You were the best till you were the worst, right?
Yeah, till I was the worst. Which was like, oh, I got my diagnosis right.
I was going to say, and that confirmed it for you.
Yeah, I got my diagnosis right. So, which I think was actually beneficial for her, even if she loved it or hated it. Like if it's a reality, it's a reality. And for him, it was really beneficial too, because it just opened up a world of resources, support, tools, all kinds of things that he could actually get his hands on, the resources that he needed because he had an idea of what was actually going on.
So what I'm hearing is it's really education you are providing. So in that resources, there's tools, there's so many things that a person can do once they have that diagnosis. So I really appreciate hearing that there's some real value in diagnosing. So I'd like to go to our first listener question.
Okay.
And here's the question. The listener says, I have a child who I think has ADHD. Well, I think he needs a diagnosis. I'm worried about the potential challenges or concerns he might feel after getting this diagnosis. I'm really wondering, is it worth it?
Oh, I think I'm hearing the actual question there. Um, but there's some things I want to say around the question, then I'll get to the question. Um, ADHD is an interesting one, Lindsay. Like I know, all of a sudden every kid had ADHD.
Mm-hmm.
I mean, have you noticed that?
100%.
Like,
Yep.
holy cow, like we're diagnosing them all. And so
Everybody.
like, I don't know if we started eating something different and everybody got ADHD, or if
Mm-hmm.
we actually just started like like somewhat normal child hyperactivity behavior. We started diagnosing and giving a label to it. I think, who knows? I don't know.
Right. I
Um,
mean, can you hear how many people say, oh, my kid with ADD, oh, he has ADD, or my ADD? I've heard that so many times. So you're right. It gets thrown around like candy. It really does.
I think to a degree, if we read the DSM and got down to ADD, I think most of us would say, "Hey, I got a little ADD in me." Um,
Mm-hmm.
and so to go as far to like label it and give a diagnosis, I think you got to be really clear with that you're meeting that criteria.
Yeah.
Um, so back to her question, though, what I'm hearing her question is like, will this harm him
Mm.
if we label him with this thing, or is it better for him to just live wild and free? And this is actually a really good question, because I think it depends a little bit on the individual, on her son. It might be really good for him to be like, oh, thanks, I have answers, this is wonderful, thanks, mom.
Mm.
It might be really shaming and really, um, one of the problems with diagnosis, and we'll talk about this later, but it it can create belief systems about self, faulty core beliefs, and drive those things home about self. And so I hear her struggle with her son of like, I don't want to do that to him, you know.
Right. And so, how does a mom know? Right. How do we know how this son is going to respond? Is it going to be like resourceful and, okay, it makes sense of what's going on? Or is it now going to be labeling? I mean, because once you do it, you can't go back.
Yeah, and I think as a parent, like um this is like master parenting here. This is like I'm thinking of my 9-year-old. Let's say my 9-year-old had ADHD. With him, I probably wouldn't be like, hey, you're ADD this. I would probably know it myself, understand it, understand how I can help him the
Mm.
best that I can, and not make his whole life about the fact that he has ADD.
Good.
Right?
Why?
Um,
You tell
because
us.
he's a
Yeah. What's your
9-year-old.
reasoning?
He's a
Mm.
9-year-old. Like,
Mm.
how much can he really take on and internalize and understand about that diagnosis anyways? What matters is that I understand it as the parent at that point. Now, when he's 12, 13, or whatever, and who knows, maybe at 9 years old, but when he's struggling at school and he doesn't know why, and he's like, feels different and out there, and it might be helpful for me to sit him down and say, hey, I want you to understand this. Um, we've gotten some good assessment, and I would make sure if I was going to go get a diagnosis for whatever, whether it's from autism to ADD to whatever, I would make sure I do it at the right place and get the right expertise to give me that diagnosis.
And what
Um,
is the right place and the right expertise?
um, at Therapy Utah, we have Dr. Brian Chandler. He's a psychologist, and his, like, what he does is psych evals. He like,
Also one of the nicest people on the planet. We'll just go ahead and add that.
yeah, but it's extensive, the work that he does to evaluate. He does a lot of assessments. So there's a difference between, me bringing my son into a therapist and the therapist is like, oh, definitely ADD, which I'm not discounting therapists. Most therapists know their stuff, right? And me bringing my son into him, a clinical psychologist who does psych eval assessments and gets really clear with, look, here's the markers of the ADD, and this is where we're scoring on the scale, and like really, really clear with it. So, yeah, I would just be cautious.
Well, and one of the things that I think that we're seeing now is a lot of people going to the pediatrician and they're doing some mental health assessments now, right? They're looking at some mental health things that they didn't do certainly when we were growing up.
Right.
But they're looking at that, and it seems like there's a lot of times that kids are getting medication from their pediatrician. What are your thoughts on that? I mean, maybe even before an assessment and there's an evaluation. I mean, let's say it's your 9-year-old kid. Let's go back to that. What are your thoughts on that?
This could open a can of worms. So it could be very beneficial, or it could be very problematic in my opinion. And really we got to start with the individual. Like if we're talking about diagnosing a child, I think we need to be really careful about what it means to if we're putting them on like heavy medication, what does that mean? Versus like, let's say it's ADD versus dealing with a little bit of annoyance at home. And I shouldn't say a little bit, because people listening who have children with ADHD are like, Brannon, you don't get it. Right?
Not a lot, not a little. Yeah.
Yeah. So and that's where we got to come back and say, okay, like, is this problematic enough that the pros outweigh the cons here? You kind of do a cost benefit analysis of this thing, diagnose it, and realize this is what's best for them. And who makes that determination? Right? It's really a tricky thing.
Well, and as you were talking, you said, this is really master parenting. And I thought that's what this is as well, is really master parenting, because it really takes work on the parents' part to say, okay, are they in a position where medication would be beneficial or a diagnosis would be beneficial? Or how do I need to change my behavior? If this is what I think is going on, then how do I change the way I show up as a parent with this child that I think might have ADHD?
I think you're speaking from experience as a therapist there, Lindsay, of like, a lot of times we see as therapists, like, stop diagnosing your darn kids, stop medicating them. You're the problem. Like, Come on, like, make some changes here and your kid will be fine. It's not them. Yep. And I think that's really sad when the kid gets medicated and labeled and diagnosed, when really it's a parenting issue. That is really sad.
And that's hard to look in the mirror and go, wow, maybe as a parent, I've got some things that I need to consider. I've got some things I need to look at. Maybe I'm really triggered by this child because I've got some things I need to work on and clear up in my own life. That's hard.
That is hard.
Yeah. That's the hard work of therapy, when you're willing to look at yourself in the mirror and say, all right, I got to do some work around this. And I would imagine it's a good time of introspection for at any time a parent to be doing this, right? If your child is suffering in this way and needs help, it'd be a really good time to do that regardless.
Yeah, absolutely.
Okay. So what I'm hearing you say is it's worth it, but walk gingerly, be aware.
Yeah, I think a lot of times in our Western medicine minds, it's just, hey, I have a problem, I need a diagnosis, and I need a quick fix pill, whatever, to fix it. Yep. Versus a holistic approach, more bottom-up healing is taking a full assessment of what's going on here.
Can you explain bottom-up to our listeners?
Yeah, it's like, diagnosis definitely works for top-down healing more so, which is, I got a problem, let me label it and think about it and see it, and then let me treat it by doing A, B, or C. Bottom up is more, okay, like something, I'm getting consequences in my life I don't like. Something's not right here. What's going on internally from the inside out that's creating those things? So maybe it's not about this diagnosis. Maybe it's about all of the friends that I hang out with and the job that I have and the life that I'm living. And so I'm going to shift some things internally and get rid of some of those things so that I can change the outcomes of my life versus look at the outcome, treat the outcome. And that's why diagnosis works for that top down really well in a Western medicine type of thinking. And I think we need a combination of the two sometimes.
Nice.
Where it's really helpful to be like, that's what it is. We see it. And it's really problematic to be like, that's what it is. We see it. So my approach would be thorough and careful. When we talk about master parenting for our children, like I wouldn't take my kids to anybody to just get a diagnosis. And I wouldn't just believe any diagnosis that I got from anyone off the street. I would be very careful, cautious, get good resources, good experts, and go about it that way.
Yeah. Do your homework. It sounds like this is not a easy button your way out of this thing, right? As no parenting is. I don't think any part of parenting you can really easy button your way out. I've pretty much learned. So that's great. Well, it's really valuable to hear why the benefits of a mental health diagnosis and that there are benefits. And while there are benefits, it's something we really need to look at critically, ask some really tough questions, look at ourselves, look at the benefits, look at the costs, really try to have a holistic perspective when we're considering diagnosing a child in particular. So really getting help with mental health is a big decision. It takes courage to acknowledge that you need help, whether it's you or your child. Getting a mental health diagnosis may help you communicate with others what you're going through and the ways that you need support. If you like this episode, please share it with your friends, rate it and review, and we'll see you next time.